Horrific gang targeting newborns. The untold story exposed. Newborn deaths, forged documents, illegal gains, bribery and corruption. In today's video, we will discuss the newborn gang scandal that shook Turkey's agenda. This gang is an inhumane fraud chain that turned the neonatal intensive care units of private hospitals in Istanbul into a source of income, causing the deaths of 12 babies and endangering the lives of many more. So, who is behind this gang? How were the baby deaths manipulated? How did this terrible network get caught? You will find the answers to all these questions in this video. In March 2023, a tip-off about irregularities in newborn intensive care units in Istanbul led to a major scandal. This criminal organization, known as the Newborn Gang, had established a fraud network involving 19 private hospitals and was making unjust profits through the Social Security Board, disregarding the lives of babies. As part of the investigation, 47 suspects were detained and 22 of them were arrested. According to the indictment, this criminal organization is held responsible for the deaths of at least 12 babies. So what was this fraud method? The organization abused the daily payment of 8,000 TL made by the state to newborn intensive care units. And by keeping even healthy babies in intensive care for long periods of time, it made large amounts of unjust profits from the Social Security institution. The health conditions of the babies were shown to be bad with forged documents, and even records were kept as if the babies were intubated even if they were not. This situation both strained the state's budget and disregarded the lives of innocent babies. One of the most striking aspects of the criminal organization was that even some newborn deaths were part of this fraud chain. Babies who were shown to be healthy in hospitals lost their lives under inappropriate treatment. Messages emerged in which members of the organization deliberately put a baby in danger of death and gave instructions to kill the child. The message is that the organization members wanted the deaths of Turkish babies, while not wanting the deaths of Syrian and Arab babies, frightened the elderly. Now let's look at those records.
He said I bought 900 grams from Cam Sakura, bro.
I hope he is not Syrian.
He is Turkish. I talked to him yesterday. I said a lot. I said we don't want Syrian. He is coming. We need a Turk. The Syrian patients is useless.
It is understood that the gang is targeting the children of Turkish families in order to collect their debts easily. It is also seen that gang members make jokes about the way babies die, sometimes hasten their deaths, and write suspicious reasons in the death reports. It is also understood from the phone conversations that the organization took a 6-month-old baby to the neonatal unit for the sake of money, despite it being prohibited, and caused it to die. Gang leaders. The person shown as the leader of this organization is Dr. Ferhat Saru, the owner of Medisense Health Services. Dr. Ferhat Saru has been convicted of being a member of a terrorist organization in the past and is known as one of the key names organizing this criminal network. Another important name in the organization is Dr. İlker Gönen, who cooperated with the 112 emergency call center and ensured that babies were referred to private hospitals unnecessarily. These two names turned hospitals into businesses through bribery and forgery, endangering the lives of babies and making millions of liras worth of unjust profit. The bribery wheel. This crime chain, which also included 112 emergency call center employees, was based on a large bribery wheel that revolved around patient referrals. It was determined that regular payments were made to gang members in return for irregular referrals to private hospitals. It was determined that ambulance drivers and hospital staff in particular were in close cooperation with this network. This horrific incident has opened a huge wound in the Turkish healthcare system and exposed the fact that the lives of newborn babies are being put at risk. The Turkish Minister of Health said that these inhumane practices that cause infant deaths will be punished in the most severe way. While Turkey is shaken by the repercussions of this horrific incident, the investigation is still ongoing and all members of this fraud network will be brought to justice. While the public is losing trust in the healthcare system, they also think that all these events are a genocide against the Turkish race due to the femicides, corruption, and gang formations in their own country, and the fact that they are seen as less valuable than a Syrian or an Arab, and their security is not ensured. How will we, who are now considered second-class citizens in our own country, live on? What do you think about this? What are the reasons for these events and the endless deaths of women, children, and young people? Why can't Turks fit into the Turkey? Your ideas are very important to me. Let's meet in the comments on this subject. If you continue to follow this channel to follow such incidents and inform the society, we will never allow these crimes to be covered up.